Hello everyone, my name is Jonathan Parr, physical therapist and EDS and POT specialist, and today's webinar is From Flare to Function PT Insights on the Trifecta. Now I won't dive too much into each individual one, but a brief overview. We know that EDS, HEDS, POTS, and MCAS tend to go together in this specific scenario of the Trifecta. There are other versions where you might get a portion of it. You might just have EDS and POTS together. You might just have EDS and MCAS. But typically what we find is with this grouping of conditions, it can be very debilitating. It can be very frustrating because not too many practitioners know about it or understand how to treat it, as well as physicians who are fairly new to these diagnoses coming together, whereas individually they tend to work very, very well. But that's not the case, especially when it comes to all the zebras out there. There's a lot of different things that happen even if the patients have the same exact diagnosis. So we want to make sure that we look at it from an individual standpoint, but also look at it from a broad standpoint. Really want to use this webinar to validate the invisible illness that most people don't necessarily understand, and how to go about planning and finding providers that can better help you with your specific condition and needs. So the first part here is really when it comes to physical therapy, a lot of people get scared because they feel like it's going to make it worse, or they've already felt worse after physical therapy, not for the fault of the therapist, but more so of the lack of knowledge regarding that specific or those specific diagnoses. So understanding that as PTs, we're not taught this in school. So it's very hard for any PT to really fully understand this grouping of conditions. So also understanding that part when you're going to facilities and trying to find providers. But physical therapy, it's not just for injuries. There's a lot that you can do with re-regulating the nervous system. And that's a big part of this, because what happens, like everyone already knows the term fight or flight, is that when you get into this fight or flight response, the body basically goes crazy, and it can cause heart rate issues, blood pressure issues, it can cause GI issues, it can cause headaches. There's so many different things that it can cause to your body, but then we have to think about how does it affect other systems. So when we're thinking about the muscular system, musculoskeletal system, if we are overactivating muscles or if we're overstraining, that can also be attributed to these sympathetic responses. So PT can help re-regulate the nervous system as well as reteach the correct muscle movements that you need in order to functionally move without any additional flare-up. But I think the important part is understanding the short-term and long-term goals, because we live in a world that we want quick fixes, and obviously dealing with the chronic illness, you do want this to be healed quicker, but we have to look at it from basically the system as a whole, from the mind and the body, that it does take a little bit of time because there's been so much that's happened to the system that it needs times to re-regulate each individual system. That way they can work together in a way that's more functional. So I would say short-term goals, expectations when it comes to physical therapy would be more of alleviation of pain symptoms, maybe less frequency of headaches, less intensity, less GI. But as far as removing it completely for short-term, it does happen in cases where people respond quick, but in most cases, no. So we want to see what are these small little milestones that we're giving ourselves as a way to track our progress and know that we're heading in the right direction. When we think about, let's say, joint subluxations and dislocations, that is the other component of slow progressive strength training, or actually neuromuscular retraining, as a way for you to learn how to connect the brain to the muscle first before you start to engage in strength training, which most people with hypermobility or EDS, they end up getting hurt too quick, because traditionally we're taught in school to strengthen if it's weak. Whereas in this case, especially when you think about the trifecta, we need to reconnect the brain to the body. That way it can be prepared for strength training. So it's a bit of a different approach. Ultimately, when we're looking at the full plan of care of what we need to do with all three of these conditions, is a paced and slow structured program versus something that you're trying to get achieve those goals super quick by going into strength training. So keeping in mind that it's the turtle wins the race kind of thing, where slow, but you'll get there once all the systems are connected. So how PT helps with hypermobility is we're looking to address joint stability and activation of these smaller muscle groups that help stabilize, but also recruiting muscles on different parts of the body. So traditionally in outpatient physical therapy, we're taught if you have a shoulder dislocation, then we're going to target the shoulder and the rhomboids, and these things really centralized or specific to the shoulder rather than looking at the opposite shoulder, making sure that we have enough core activation, we have enough hip stability, because usually the opposite hip helps with the opposite shoulder. When you're with a clinician who's a bit more specialized, they will be able to identify those things and apply those specific principles to help provide long-term results when it comes to joint stability. A thing that's not talked about enough is what happens is those with recurrent injuries, especially in the EDS world, there's not a lot of awareness and not a lot of proprioception. So there's people who will walk and they'll clip walls, or when they're driving, they look to the side and they accidentally go into the other lane. There's a bit of a disconnect between the eyes and the head, and then the head and the body. And that's a big part that right now, I know our facility is doing a lot of research, but there's a lot of information out there that supports that with hypermobility, you have to really improve the awareness, because without that awareness, you're putting additional strain on a joint that's already hypermobile. So by combining the low load strengthening with proprioceptive, with mind-body connection, this as a whole now encompasses everything that you need in order to actually sustain stability in that specific joint or in the joints throughout the body. Most providers and most doctors will be like, don't exercise, don't hurt yourself. Well, the truth is you actually need to exercise. You need to start doing it in a structured, effective, and a safe way that's planned specifically for you. A lot of times people get into specific protocols that doesn't necessarily consider something like the trifecta, mast cell, and POTS. So understanding that component as well is important, because you do want something that's a little bit more specific to you. And for an example, I think that when it comes to, I'll bring it back to shoulder, because I feel like that's a hot topic for most people, is shoulder subluxation, and people try to strengthen the shoulder itself. But when you look at the joint, what keeps the joint in the socket is actually the deltoid. So this big muscle kind of wraps around right here, and then your rotator cuff. So basically like a suction cup, and it pulls it in. They'll try to do that first before anything, which conceptually is good. But when you start thinking about it, if the shoulder blade is not in the correct position for this to function properly, then you're more likely to have increased subluxations, because the postural alignment wasn't set prior to strengthening those specific muscles. So you want to be able to actually piece together, like, okay, we're gonna start with the shoulder blade area, let's get that stronger. Then we'll transition to rotator cuff and then deltoid, or whatever that might be. But having those pieces first is super important. One, not just for the subluxation, but two, it allows your body to be more regulated, not so much in a heightened state from a sympathetic standpoint. So you're not straining to do a movement, which again can cause symptoms related to POTS or MCAS. Now, kind of speaking a little bit more about that, when we're looking at POTS and movements, typically what we find is that people will recommend, okay, just get on a recumbent bike, maybe do some Pilates, or again, what most people say, don't get up. And so it's hard to really think about these limitations when the body thrives off of movement and off the information that it needs to carry out functions on a day-to-day basis that supports the nervous system. So depending on the severity of POTS, it depends on where you start. So in our case, we have people transition from lying down exercises to sitting exercises to exercises on their knees and exercises in standing. That could be changed a little bit. There might be people who tolerate sitting better than lying down, just because them coming back up makes things worse. So there's a lot of things to consider, but when a majority of the people, if you take gravity out of it, it helps with being able to get more blood flow back to the head. It allows you to engage muscles without resisting gravity and the weight of your body, therefore reducing the probability of having a sympathetic response or that additional strain that can cause any of these flare-ups. Another part, I know the world of the vagus nerve is real. Like, we want to make sure that we can calm our body in a way that is helpful to carry out other functions. So, breathing exercises are great, but some hidden gems that we do and especially at our facility, are specific eye exercises to help retrain the proprioception and the awareness throughout the body. There's specific neck exercises that also tap into that parasympathetic nervous system. So we want to be very specific with the kind of movements that we do, not just so you're not dizzy or faint or anything like that, but we actually want to activate the systems that is also going to help your transition from lying down to sitting, sitting to standing. So there's a bit of a science when it comes into physical therapy for basically the whole trifecta, but specifically for POTS, is you have to understand what is our nervous system telling you, how are we able to regulate that nervous system prior to getting into movements that require more muscle activation, more focus, those kind of things. And also in addition to, correct diet, hydration, salt intake, all that based on whatever your physician's telling you or holistic care partner. When we think about MCAS, and I'll put all this together at the end, but I'll just break it up. So I think that when we look at MCAS as a whole, we look at like how these flare-ups happen, right? And so when we think about the flare-ups, we're thinking about if we're doing too much extensive exercise, it's going to be something that triggers that inflammatory response, right? So it's important now to make sure that we're doing the correct exercises with the correct load. That way we can gradually, let's say, if a 10 out of 10 load triggers your flare-up, we want to take that to a 3. So we want there to challenge the system a little bit, the way your body habituates or gets used to that response. So now that 3 over time is a 0 for you. It's nothing. Cool. Then we go back into an exercise that takes you to a 3. But again, you wait, it takes you back to a 0. So basically over the course of 4 different exercises, you're reaching that 10 max output, but now you're 4 exercise progressions in without ever reaching that point that causes the flare-up. How we control this is, again, through structured programs, especially through PT-specific treatments. And that also helps all the other things related to POTS and hypermobility. But when we're thinking about MCAS, is first correct programming, making sure we don't overheat, we don't cause any overexhaustion. It should feel kind of easy, but more mentally challenging than anything else. And also thinking about different environments. Is there a lot of noise that's happening? Is there a lot of fragrances? Is it temperature control? We want to make sure that where you're performing these movements or PT is actually a great environment for your specific body, right? Because every body is different, especially reducing any stress response, because if there's a lot of noise and there's a lot of people talking, that could distract you and it cause a little bit more anxiety, again, causing stress, cause more sympathetic response, the whole snowball. But the idea is you want to make sure that you start everything on a bit more gentle route on all 3 areas, as that way your body can gradually get used to it and take on a more challenging stimulus as you continue to progress. Also having like some at-home tools, because there's only a certain amount of time that you're at a physical therapy practice or whatever facility, a clinician, and there's got to be some at-home things that you do. So having like some sort of specific morning routine that already helps calm the nervous system before you even start the day is super, super important. That's one of the things that we do at our place, is that we want to make sure that your system is a bit more regulated before you start your day, because the day is going to give you what it wants to give you. But if your body is prepped, we might reduce the amount of sensitivity, the amount of impact it has on you that specific day. When it comes to posture alignment, nervous system alignment, or regulation, we're not trying to fix everything at once, but we're also trying to affect systems that will affect a lot of different areas at the same time versus, again, I use the shoulder example, just not specifically the shoulder, because your body's like a sponge. So whatever information when it comes to movement, exercise, treatments, it's taking that in information. So that is super, super important to be able to understand the importance of how or why regulating the nervous system and why having an ideal posture. No one really sits like this all day. But if one leg is slightly longer than the other, if you have a hip that's slightly tipped up, that can cause that will cause compensation, because your body's always going to try to fix itself. So you've seen people where maybe they have a bit more scoliosis, but their head is more in the middle, because their head always wants to be in the middle. But now I'm putting additional strain on my low back, on my rib cage, based on that specific position. That's really what our job is as a PT, is not only to inform you, but also show you and educate you and have you understand what it feels like to be out of alignment. Because for people who don't have awareness, you're not going to really know, like, oh, I feel like I'm in the middle, but no one's ever told me. I've never felt any other sort of sensation that allows me to perceive my middle here. And there's a lot of different testing that you can do for it to basically assess whether or not that person has a midline orientation issue. And then you can address with whatever interventions that you would like, whether movements or treatments. Also, and I say this to even my patients, is that you want to really appreciate the milestones that you make in setting realistic goals in the beginning, and understanding, something I tell my patient, the body tends to get better from the ground up. So let's say you come in with a headache and shoulder issues and constipation and subluxations on the knee and then ankle pain. Most likely, and this is what we've seen over the last 15 years, is that the body, because the most sensitive part for awareness of proprioception are at the feet. So the feet takes in more of the information, comes back up, starts to readjust, especially from a postural standpoint. So it might be that your first little milestone goal is, like, that'd be great to reduce some of this ankle and knee pain. Great, let's say you start to feel that, but now you feel like your headaches get worse. That's not abnormal. Now it's exposing the areas that are still impaired, but because the other parts are stable, that means the other parts still are trying to catch up. Also keep them in mind when it comes to progression, because you could go, an average person would be like, well, I went to this PT, my knees got better, but my head got worse. Well, it could have been that your body was actually gradually starting to heal. It just, you didn't really give it enough time to see the full results because the body needed to catch up. Or there are instances where interventions and treatments actually were worse for that specific patient because it just wasn't effective. So that's also, but just to kind of show you why making these little milestones really focus on slow progressive, was typically usually after the first 6 weeks, there's a pretty big system change in the body that you should be able to see something completely different within your nervous system, what's going on. It doesn't mean that fatigue will be completely good, because often fatigue is like the last thing to get better, because when you start thinking about the body, if it's not activating the muscles well, it can't support the body. If it can't support the body, that means that you're overactivating muscles, and it's going to cause more fatigue. So let's say now you've gone through this part where you've been able to activate everything in the body, and now you're ready to just strength train now. Well, guess what? Now you can support the body itself, but you can't handle a load. A load could be you going to school and wearing a backpack. It could be you carrying laundry. The body has to be ready for that. So now you're going through the strength training portion, which again takes a little bit longer. So now at the end of this part, you're like, okay, great, I feel stronger. I feel more connected. I don't feel like I'm compensating as much. Now that body's ready to start the endurance training, where I've seen in other cases where they try to do the endurance first, but they don't have enough muscle contraction to even just sustain the time that you need to be on a bike. Whereas you need actual muscle strength to transition into the endurance component to help strengthen the blood flow push back up to the brain in order to achieve the goal of not being as fatigued. This can vary as well. I know medications, I know other secondary diagnoses can affect this, but I'm saying in general, this is typically what we see from a PT standpoint. And I think it's also really, really important that, let's say you're going to a place for, and I would say giving at least 2 months at whatever facility you go to or whatever practitioner you go to, it's okay to change approaches if you don't feel comfortable, if you're maybe not fully aware, kind of advocating for yourself that it's okay to try something different. There's been plenty of times where, if there's a technique that's not necessarily working for one of my patients, I'm like, hey, this technique might work a little bit better for you. Maybe it's a little bit lighter. It's something that still fits within the realm of trying to regulate the nervous system, but it's a bit different. So also understanding it's okay to be able to change, but also having the patience to stick it out a little bit longer to really feel the changes, because it does not come overnight. Summing most of this up, I think from a communication with providers, I think it's important having, being a clinician and talking to patients. I think it's important that the PTs do educate you on what it is that they're trying to do. Ask a lot of questions. Why is it that my knee hurts every time I sit down? Or why is it that I've been coming for 8 weeks and I still have a headache? Those are valid questions, and as clinicians, we should be able to answer that question. If we can't answer that question, that might be kind of a flag to possibly seek out other providers, because sometimes providers might be in season. Maybe they helped you from season 1, but there's a part of that season that needs to have someone who has a little bit more expertise. You can go to that one. It's like, you just want to make sure that you're communicating as best as you can. And also having an understanding, because I think the one that I get the most is pain. Well, I always have pain. Well, there's various forms of pain. It could be dull deep, it could be sharp shooting, it could be radiating down the arm, it could be maybe it's just muscle soreness, but the person who's been in chronic pain for so long can't differentiate. It's important that as PTs we help them understand. That way each person understands, so they don't feel like, let's say they're just sore from working out, they don't get anxious and freak out about the pain, and it causes another sympathetic response versus them understanding, okay, I'm just sore, I'm just gonna take a little rest, I'm gonna hydrate, I'm gonna eat. And then that also helps the system calm down as well. So it's almost, we're also retraining the brain on how to respond to different stimulus, and which is super, super important when it comes to PT. When it comes to movement, it's not a no pain, no gain thing, or you need to push through it. That's very important to understand. That doesn't necessarily work for this approach. In my opinion, it doesn't work for really a lot of approaches when it comes to just recovery. I think there needs to be a threshold, but I think when you start to put past it, that actually affects that nervous system that we're trying to re-regulate, that it's basically counterintuitive to what we're trying to accomplish. I think a one-size-fits-all approach is also very tricky. I mean, I know, for our we finally were able to make an online program that's very specific for POTS and EDS, but it is not a one-size-fits-all. So I'm typically, what we do, like 80% of the people typically fit our progressions, and then 20% that don't, we make a customized program. So having that communication and really having those discussions with your provider is really, really important, especially as you go, through, each program, each level, whatever that might be. We have a ton of tools on our website that are free on our frequently asked questions. It goes, we even have our blog, and actually our podcast will be coming here soon, called Everything is Connected, where we're going to start giving a lot more informative stuff specific to how PT can help with these conditions, and just giving like some alternative resources for people to use and possibly find other providers, or also have access to some of our tools. We have some online programs. We'll have some support groups coming soon. We really are focused on really trying to drive more of the research coming forward when it comes to this condition. And hopefully by next year we'll have our first published research essentially over brain activity when it comes to EDS and POTS. But yeah, I think that finding great support groups in your area, and also being mindful about the support groups, because I think it's really, really important to use the platform as a way to get support, but not necessarily dump a lot of, let's say, everyone can have some sort of medical trauma on the other person, because it might deter them. If you had a bad experience with a PT, doesn't mean that PT is bad. Or vice versa, if you had a bad experience with a chiropractor, not basically pushing that on someone else and not see a chiropractor, because there might be a lot of chiropractors that can help. There might be a lot of PTs. So just being mindful, like the support groups is really, really coming together and seeing which providers have been very, very helpful for that population, and then using it, and finding ways to discuss it. If they have symptoms, I think it's important that if someone's maybe on the top end of the recovery and someone's on the bottom, being able to talk to someone that's already been through it as a way to motivate you. Because not ever having had a condition like this, I know that I can only imagine how hard it is when you don't have support. And so I love these groups. I guess to really close it all in, it's been a pleasure talking about this. I'll be definitely putting out more content specific for this. Again, if you're looking to connect with us, we have our Instagram, Parr_PT. Same thing for our TikTok. Whatever it is, it's going to be the same thing. And we'll have some guides online. We even have like a flexibility guide that kind of teaches you a little bit more for those who are a bit more hypermobile, how far is too far. And so we have some free guides. We have some programs. We have even services related to virtual coaching if anyone even has any questions. But just know that we're a resource, and there's so many other people out there that are willing to help. But having a better understanding how these three work together and understand the timeline of progress is key, but also to know that there's still hope. Thank you.